Hi everyone, this is Tulsi Desai. I'm a physical therapist. I wanted to talk about nerve irritation or nerve injury, but mainly irritation, and how it could be easily misdiagnosed as disc bulge causing the symptoms in a patient. So I had a relative call me this morning and tell me that she injured herself recently and started getting this shooting pain in her arm. So I had to ask her how she injured herself, and she was trying to reach in the back seat of her car, and she felt straining her elbow, and she was fine for the rest of the day. She knew she moved too far, but she was fine for the rest of the day. She was fine the next day, but later in the evening next day she started having this shooting pain in her arm, and no, she would be fine if she didn't move her arm, but if she moved it in certain directions, in certain way where it would stretch the nerve, she would feel this shooting pain all the way down to her ring finger. So I could, like, just from the history, I could tell it was more of a nerve irritation. She probably hyperextended herself and strained the nerve. So I had her do some nerve provocation test because she's in India, I'm in United States. So I had to do whatever I could do over the phone, and I made her do certain movements of her neck while her arm was in certain position, and I had to just kind of see if I could provoke her symptoms. And her symptoms wouldn't change with neck movement, but her symptoms would get aggravated right away as soon as I would make her change her wrist or her elbow position in certain way. So the nerve was irritated at the elbow level, but there was nothing going on with the neck or the shoulder region. So the good part, she knows me, she has known me for a long time, and she knew she could call me right away and get some help before things got any worse, because such shooting pain she knew wasn't going to calm down. But she's also a very well informed person, and she herself is in healthcare, so she could tell this was nerve irritation or injury, and she shouldn't be ignoring it if she was getting shooting pain. Whereas a normal person would just wait and watch and for 2-3 weeks, and then by that time the nerve is irritated throughout its length, because it's not going to calm down on its own when it's so bad. And at that point they'll start getting probably some neck spasm, they're not moving as much, they're starting to get stiff, and then they would maybe 1-2 months down the road, if it's getting really bad where it starts burning or tingling or numbness, then they would go to an orthopedist or neurologist and maybe get painkiller, muscle relaxant, get MRI done at that point. And you can see how things can escalate from that point because you ignored the problem for a few weeks or a few months, versus going and getting it checked right away from the appropriate medical professional. So I evaluated over the phone and with video chat, and kind of saw what was going on, and I gave her some stretching exercise that would help calm down the nerve without irritating it more and make sure she doesn't start getting stiff. We're going to see in a few days how she does and if her symptoms are getting better or worse, and then we'll take it from there. But I'm sure I can help this person a lot faster because as soon as she consulted me right away, she did not wait, and she's going to at least prevent things from getting worse. So I feel like this is a very good example of how being proactive and being attuned to your body and knowing what's a dangerous injury and you should seek help as soon as you can, and what's an average injury where you could maybe safely wait and see how it goes, and then maybe after a week or two go see a doctor if it doesn't get better on its own. And shooting pain in your arm is never a normal sensation. Any tingling, numbness, or burning in your arm is generally a nerve irritation symptom. So make sure if you're experiencing any of that, go to an orthopedist or a physical therapist and get it checked. In my personal preference, I would first go to physical therapist if that's something that's doable in your case, because at least you're not going to go through an MRI or nerve conduction test right away. Also, nerve conduction tests, they show if your nerves are functioning properly or not, but a lot of times they are negative because the nerve has to be affected or damaged to certain level before the test can show any negative effects. So then a lot of times it doesn't show anything on the test, and then if the MRI shows disc bulge, you get diagnosed as bulging disc, whereas the neck has nothing to do with symptoms in the arm in this particular relative that called me. So this is a perfect example that not every neck problem or radicular symptom has to be a bulging disc. A lot of times it can be nerve entrapment or irritation at the length of your arm or your leg, anywhere in between muscles. Okay, I hope this was helpful. If you liked it, if you found it helpful, give me thumbs up and share this if you can, or comment below if you liked it, and I'll see you next time.